Hello, my name is Debbie Gilley. I'm a radiation protection specialist with the Division of Radiation Transport and Waste Safety, Radiation Safety and Monitoring Section, and the Radiation Protection of Patients Unit at the International Atomic Energy Agency. Today I'm going to talk to you about strengthening radiation safety culture in medicine through training that's been developed by the IAEA. The objectives of this presentation is to provide participants with information on the importance of safety culture and quality in radiation technologies used in medicine, provide information on the development of the training material using a novel approach for stakeholder participation, and provide information on the training material and how it can be used to facilitate improved knowledge and change in behavior, improving radiation safety culture. First, let's go back to the basics, the International Basic Safety Standard, and why safety culture is so important in the work we do. We understand that all principal parties shall promote and maintain safety culture, and the basic safety standards outline some of those activities specifically. Promoting individual and collective commitment to protection and safety at all levels of the organization. Ensuring a common understanding of the key aspects of safety culture within the organization. Providing the means by which the organization supports individuals and teams in carrying out their tasks safely and successfully, with account taken on the interactions between individuals, technology, and the organization. Encouraging the participation of workers and their representatives and other relevant persons in the development and implementation of policies, rules, procedures dealing with protection and safety. Continuing on with the International Basic Safety Standards, ensuring accountability of the organization and of individuals at all levels for protection and safety. Encouraging open communications with regard to protection and safety within the organization and with relevant parties as appropriate. Encouraging a questioning and learning attitude and discouraging complacency with regard to protection and safety, and providing means by which the organization continually seeks to develop and strengthen its safety culture. In recent General Conference with the IAEA, we've had resolutions that are brought forth the importance of safety culture in September of 2018, 2019, and 2020. This resolution states that recognizing that embedding and enhancing safety culture is a key element of the peaceful uses of nuclear energy, ionizing radiation, and radioactive materials. This resolution encourages member states to continue to enhance safety culture at all levels in their nuclear and radiation activities and requests the Secretariat to support member states upon request in promoting, accessing, and improving safety culture in all relevant organizations, including the regulatory body oversight of licensing safety culture and on practices to promote and sustain the regulatory body's own safety culture. The bond call for action, one of the 10 action items that came out of the meeting in 2012, was to strengthen radiation safety culture in healthcare. So what is safety culture in the words of IAEA? It's the assembly of characteristics and attitudes in organizations and individuals which establishes that as an overriding priority, protection and safety issues receive the attention warranted by their significance. The common language of that is how we do things around here. It's based on individual assumptions, beliefs, and attitudes about safety and are an essential part of an organizational safety culture that embraces a culture of health and safety. Why are we focused on safety and safety culture in medicine? We have events reported in radiation use in medicine provides an opportunity to discuss the needs for both radiation safety and patient safety. The IAEA has promoted the importance of safety through standards, guides, and reports. But as long as humans are involved in patient care, we will continue to have safety concerns. A strong radiation safety culture is the foundation for improving patient safety. We know from experience that there is a link between safety culture and better decision making in respect to risk management, and this ultimately leads to less injuries and fatalities in the workplace. All radiation protection professionals should feel responsible for shaping the overall culture in their organization as part of their duties. In In addition, leaders should especially welcome the opportunity to create and maintain a safe working place. The development of the training material by IAEA identified 10 traits that are essential for a strong safety culture. These 10 traits are based on other industries of high technology industries such as the nuclear industry, space industry, aviation industry, and some other engineering industries out there. We identified Beth methodology to influence behavior change. This type of training and is different than many other types of training that we do, and therefore we need to figure out a way to develop the training material and how to deliver the training material so that we get the return on that investment and have that improvement in the safety culture within medical institutions. What are traits? Traits are a pattern of thinking, feeling, or behaving. They're more difficult to teach and learn. They requires a modification in one's own culture, therefore influencing the culture of the organization, and by influence that culture to another set of people, which could include patients, caregivers, and others, other people that would be involved in healthcare activities. Cultural shifts happen over time. Improvements may not be measured immediately. We see the changes in culture happen over a period of time as we slowly but surely see those small changes happening until we have a measurable change that we can actually measure. So in preparing the material, training material by the IAEA, we looked at the objectives of the overall process, what we were trying to do, which is actually improve safety culture in healthcare. We wanted to introduce each of the traits and show how those traits have influence in radiation medicine. And we wanted to use, and we use case studies to do this. So we have case studies in radiography, nuclear medicine, radiotherapy, and worker protection. From these case studies, we will carry on a facilitated discussion, and we will look at this particular case study and have individuals talk about things that could have been different in that particular case study. We'll move that discussion on to what this particular trait and how this particular trait can be strengthened within the participants' own facilities or own organizations, with the expectations that some of the information that is brought forth in this will be taken back to the institution in an effort to strengthen the safety culture. Facilitated discussion is one of the more difficult ways to teach activities, didactic training in worksheets, and seem to be the way we do a lot of things. Mathematical calculations. Facilitated discussion is where you actually encourage people to talk and come up with solutions. It has a great positive influence on group-based behavioral changes. It has a side activity is that if you do this within an organization, these type of trainings, we see an improvement in the communication across, down, and up an organization. It does require facilitators to be experienced at keeping the positive focus on the discussion. It's very easy for these things to go south, as they say. And there needs to be a way to come back with key points at the end of discussion so that we can stay focused on the positive aspect of improvements within an organization. We reviewed the material, had a consultancy in February of this past year. We had representatives from each of our regions, and we had representatives from professional organizations that are going to be one of the organizations that will help us get this information out. Maria Perez was there. We had a representative from IRPA there. We had a representative, Madan Rian, from the International Organization of Medical Physicists. And we had the winners of our digital contest. I want to spend just a few minutes talking about the reason why we did a digital contest and how we expect this to have a positive influence on changing culture. We know that peer-to-peer training is sometimes the best training that we can provide. If we see another person that can do this or another organization that's been successful at this, it's easy for us to adapt that into our own organization. So by encouraging radiation medical professionals to participate in the development of the coursework, we were able to draw some experience from them, but we were also able to raise the awareness of the need to strengthen radiation safety culture in medicine. We wanted to draw on the adult learner who in many cases is visual. We get bombarded with lots of information every day, and we really wanted to try to focus on those visual images that seem to have the lasting power for many, many adult learners. That positive influence is what we would hope that would come out of this training. And we believe that this is a method that we can engage with potential future students and trainers in a long-term process by having these digital presentations there to be presented as well as to be talked about. The course material is 2 handbooks. We have a handbook for the student, and we also have an instructor's manual that provides them guidance and some information on how to carry out the facilitated discussion, how to mix up the methodologies within the classroom to encourage more participation. In the course material, we have a short PowerPoint presentation of about 5 slides is all. Because this is not a didactic training program, this is a facilitated discussion program. We use case studies, and each of these case studies are based on true events that have happened throughout the world. The facilitated discussion is broken down into 2 activities. One is to discuss the case study, and the second is to discuss the trait-specific questions on how we can change and improve and strengthen safety culture in an individual institution. The last is some positive behavior change questions that will help the participants figure out ways in which they can do activities within their own organization. And then we suggest that you do the digital presentation at the end of each of the traits so that you will have those visual cues to remind you of things that can be done. Here are the traits that we have. And here's a little bit of the overview of what we do. We do have some key information boxes, and then the handbooks are for the students. And we hope that they will use these and go back to them in a timely fashion every year or so and maybe readdress what was successful in the year before and maybe what they need to work on or focus on in the upcoming year in strengthening safety culture. This is coordination with other organizations. As Bernard has talked about earlier in this presentation, you will see similarities between what we are doing with the joint project, the publication from World Health Organization, the International Radiation Protection Association, the International Organization of Medical Physicists, and you'll see that we talk about the same basic safety culture traits in that publication as well. So the course material is available. This is the website for downloading both the student handbook and the instructor handbook. I hope that this year we will be able to go out and do some training for facilitators. It would be nice to have at least one trained facilitator within each country, and we hope we'll be able to do that the last half of this year. Thank you.